July of 2020. We had gone on a trip. When we got back, I noticed that his right foot looked very swollen and it was very hot and red. Maybe about a year, not quite a year later, he got it in the left foot. He eventually got a wound on the bottom and it just seemed to get bigger. And he ended up in the hospital with sepsis, MRSA, bacteremia, osteomyelitis, and it was a result of this sore, which actually was an abscess. That is where we were introduced to Dr. DiPierro. Thank God.
Hey, all right.
Been busy,
I
man.
know.
He explained what he was going to do. He was going to go in, he had to shave, he had to basically reconstruct the bones that had shifted and that were causing these sores.
I will not forget the first time I met Mr. Kosensky. He was in the hospital with a really acute problem with an infection. I remember that he was very frustrated, having dealt with something for so long. Surgically, I was able to take him into the hospital to do a staged approach where we clear the infection surgically, converting to a clean wound and optimizing his body so that he has the potential to heal. The next surgery that was more of in his case, a soft tissue reconstruction. I had to address a bony problem by resecting some of the bone that was leading to the ulceration, and then able to do a small plastic surgery technique, transferring his muscle back into the covering the bone, and then shifting his skin around and transferring it to heal skin to skin and get rid of the ulcer. So throughout his time, he has been a good patient, addressing all of his medical problems with his primary and taking his medications. And his success is in large part due to his efforts and the support he had from his wife.
To me, the difference is he just went right in and knew what he had to do and did it, and it worked.
My first visit here was outstanding. The first time I met with him, and he basically went over everything that was going on and what he had planned to do. He was such a thorough doctor. I say, don't waste no time going to see him.